What does APSGN stand for? Acute post-strep glomerulonephritis. Good. All right. So how did it start? Oh God, I've never seen your arms before. I didn't know you had them. All right. So acute means it's happening right now. Post-strep. After strep. So you had a strep infection either in your throat or on your skin. What's it called on your skin? That is not true.
The other one.
The what?
What is it?
In the fridge.
It is.
Okay, I don't know. You have to look in the drawers and see if there's any in there. Where all the sauces are. Go look in there.
It's not scarlet fever. It's the other one.
Yeah, strep of the skin. Little lesions, honey crusted lesions. Oh, impetigo. I didn't hear her say that. Sorry, she was. Okay. So they had strep. Their body reacted to the strep and created a
Giant
antibody complex. Okay, so is the strep dead?
No.
You know, yes. Yes, it is. Okay. And then this complex has to be gotten rid of. And how do you get rid of it? Through the kidneys. And the glomeruli is this big. And the complexes are that big. And so it rips through it, causing it to bleed really bad, and then it swells shut. Yes? So what's the number one sign and symptom of APSGN? Massive hematuria. Yes? Okay. Then are they peeing at all? Very little to none. So that is called, very little is called oliguria. Good, good. And so what's going to happen to your blood pressure? Where's your fluid? It's inside. So you're going to have hypertension. That is the most dangerous part of this whole shebang. You could have a stroke. So we ought to treat that first, shall we? Okay. Just so you know, this happens to boys more than girls. I don't care. Mostly in school age, because that's when kids get strep, because they're nasty and they share things, right? Cool, cool. All right, so we've got hypertension, oliguria. What color is the urine? No.
Red.
No. Tea-colored or Coca-Cola colored urine. You named on everything except for the right one. So it is tea gets brown because it's like old blood. Yes, because by the time it got through the glomeruli, it went all through the loops and it's brown. Yes? Cool. There's only one place you have swelling in APSGN because you do not have massive swelling anywhere. It all stays in the vessels except for one spot. Oh. The only place you have edema. Y'all been digging in it all day, so yeah. So you got I'm glad as the eye. Paraorbital edema. Remember we talked about how this is major hydration status, right? Okay. So they may get puffy eyes in the morning, and then the parents will be like, oh my God, their eyes are like super swollen. Call the doctor. Hey, we need to come in. Our eyes are swollen. I don't know why. And then as she gets up throughout the day, like they're not as swollen, right? So they may be like, oh, never mind. It's fine. It's not fine though. Yeah. And then they just feel really crummy because they have tons of fluid. They're in fluid volume overload. So how do you feel when you're in fluid volume overload? What? Malaise. You think they're going to feel like eating. So anorexia, what happens to their weight? Increases. They got weight gain. They're just irritable and kind of pissy, and they don't feel good. And they start building up in waste products everywhere because their kidneys can't get rid of it. What's it called when you got waste products everywhere? Azotemia. Okay. What is the big molecule that is allowed to go through other than blood? Protein. So you have massive hematuria and a teeny bit of proteinuria. And then we go to nephrotic syndrome, it'll switch upside down. You remember that? It's massive proteinuria and then a little bit of hematuria. Understand what I mean? Okay. All right. How do we diagnose APSGN? How do we know they've had a recent strep infection? It's a blood test. It has a name. Oh, there's a middle letter. ASO titer. It's an ASO titer. Okay. What stands for? Good, good. Yes, something strep.
Something.
Yeah.
Antibodies.
Just say the first part of the word you said. But just the first. Anti-streptolysin titer. Good. Good. Anti-streptolysin titer. So it's an anti-streptolysin, which makes sense because it lysed the strep, but then it left this remnant behind. Do you understand what I mean? ASO titer. So if the ASO titer is positive and you look at the UA and it has massive amounts of blood and a little bit of protein, okay, and their BUN and creatinine to start to climb and they have tea-colored urine, you're like, that's the APSGN. Yes? Okay. What is the priority for this child? Back at you. How do we prevent that? How do we prevent stroke? Okay. So the priority for this kid is to give them antihypertensives and control the blood pressure. So you understand. What is the priority way that we would assess their fluid volume status? Daily weight. Be very careful how this is worded on an exam. If they say what's the best indicator of this patient's fluid balance, you would choose daily weight. If they said what is the priority to treat for this child, you would say blood pressure, not daily weight. That's not a priority. You see what I mean? Hurry up and do one weight, you know. You understand what I mean?
Yeah.
Are we
I
very
feel like
clear?
It's really weird that you're having to point that out.
This has been a problem in the past. It's a hard concept to understand. So I know you're not looking at it, but right here I wrote priority is to treat the hypertension. However, it's very important to do a daily weight to assess their status. Okay. But anytime they ask you to do like what's the priority, it's pretty much not going to be one thing a day. Do you understand what I mean? Okay. Okay.
Right now.
Yeah. What can I do right now? Give them an antihypertensive. All right. What do you want to do as far as diet on this kiddo? Low salts. Mm-hmm. It's okay. No, you don't have to. They can drink or eat if they want to. But do you want to give them a lot of fluids? So they have to go on a fluid restriction. Y'all know with fluid restrictions, you need to space out the fluids over a period of time. Okay. Yeah. Okay. We're gonna get their BP every 4, which you should have known anyway. That's when you get vitals. Yes. Do they need antibiotics? No, because it's gone. But I will do a rapid strep and I will do a throat culture just to make sure it's not still there, because it could be still there, and make sure they don't have impetigo still present. Okay, but most of the time this is a dead strep. That's why it's called a poststreptococcal. Okay, we're gonna be doing UAs every couple hours. What am I looking for? Protein and blood. Okay, then we're gonna draw something called a C3. Anybody know what a C3 is? Okay, it's part of the immune system. What part of the immune system has this? Starts with a C. It was in my immune chart. Oh, I don't know if you were here. You weren't here for that. Yeah. It has a whole system, a whole cascade. You were here.
I didn't come into the last.
The last what?
The last exam.
No, you came from the very freaking beginning.
I did not.
Yeah.
I didn't come to heme. I didn't come for any of that.
But you did them online. I remember it for some reason. You didn't do a good job of them online, but you did them online. Yeah, they weren't for you. Yeah. See, anybody, come on. It's a whole thing. Like there's a whole cascade in your immune system that's named this. If I wanted to tell you something nice about you, I would. Okay. So it's a complement system. The whole complement, that's like a big part of your immune system. Anyway, if they have APSGN, their C3, which is their complement 3, is going to be low because it is exhausted and overused. So we're going to just draw those serially to see if those are improving. You with? Okay. This can pretty much damage your kidneys for like, yeah, and that's called, it's a really hard one. Well, an AKI is an acute kidney injury, but it can lead to, it's not a chronic kidney disease. It is flat out renal failure. It is acute renal failure. It's okay, everyone. So you do have to watch their electrolytes, because when they start going into renal failure, what's your potassium going to do? It's going to increase. So you need to watch that. Yes? Okay. So being as though I don't want them to retain potassium, I probably would hold the potassium foods as well. Yeah? So lower sodium, lower potassium. Because if they're not peeing, no pee, no K. Do we understand? All right. Y'all did pretty good on that. Questions on APSGN?